I just wrapped up one of the most challenging, mind-opening, and sentimental experiences of my life. For a bit of background, my name is Isabella. I'm a university student with a big interest in enabling health infrastructure. Health infrastructure includes the obvious things like interior design, patient-provider interactions, medical devices, transport to and from these facilities, but also the more contextual, second order elements of what it means to be healthy. For example, nutrition, self-awareness, inquiry, community. I believe that all of these things, the first order health system and how strong a facility is, and the supporting lifestyle and community all contribute to what it means to be a healthy, happy human. And that's what I want to create and build. This summer, I'm focused on a specific project. It's a health clinic in Mugamba, Bururi Province, Burundi, and they want to be one of the best teaching hospitals in the world. Right now, they are a simple clinic with 2 doctors, 5 nurses. They mostly attend to pregnant women and infants, but they also have some emergency capacity and a transfer service. So this summer, I was focused on establishing a quality improvement program for the clinic. And in the rest of this video, I want to share 4 things I've learned from being on ground in Burundi trying to make something happen. The first lesson is save people time. In focusing on saving people's time, which often has to do with clarity and length, you will probably reduce the amount of back and forth it takes to get something done. For example, my project at the clinic had an element tied to the Joint Commission International Primary Care Standards. It was this long document with a lot of well-articulated goals that were in English. So I asked the translator to help me convert this document into a French or Kirundi version so that everyone in the community could know what this health center was striving towards. The challenge was his computer had been stolen. So we were working with phones and paper. I thought, okay, well, maybe we can print it and then we can start thinking about, how to translate it. What I realized is I had a computer. I could just spend time copying and pasting this document, maybe an hour, and turning it into French by some AI plugin. I ended up using Notion AI. And then I could print out that document and give it to him so he can just mark off the edits. This ended up being way better than me printing off the English version, which would have been way less work for me. Literally, press print, here you go. But it would have been so much more work for him in having to handwrite or type on his phone 30 pages of documentation. Instead, I got 80% of the way there with technology, printed that off, and then he just had to mark it down, and then I already had a version of the file that I could quickly edit. On the front load, it's more work for me. But when I needed something else to be translated, my translator wasn't spending weeks on this document. He only had to spend a couple of days because I made it super easy. So then the next thing comes around and I can share that as well. And then we can produce way more results in terms of translated documents by just doing a little bit more work on my end. I think this is also really applicable to emails. Specifically, thinking about what someone will say to the email. Is it a yes or no question? Is it a possible clarification? Will they want to see this other document? If you spend a little bit of time thinking about that, chances are you will probably be able to answer some of your own questions, realizing you know what someone's going to say, or you'll be able to include a document that they'll probably ask later on for reference. Now, you might not perfectly be able to predict what the other person will respond, but by spending that extra 10 or 15 minutes, you will save someone else's time, but you'll also reduce the amount of back and forth you need to do in that email chain. The basis of my project is actually just time saving. I basically became an expert in reading World Health Organization policies and documents for this level and context of healthcare. But the problem is, which you'll see, I wrote an article, I made a video, I talked a lot about this, but these documents are anything but concise. And the problem with on-ground workers in constrained environments is that they have anything but time. So I kind of consolidated those verbose but important guidelines into bite-sized nuggets that were applicable and relevant to these constrained but amazing healthcare workers. So even just the notion of my entire project was about saving other people's time. And in that pursuit, I was able to create something that was really valuable to the clinic. Okay, the next lesson is to empower champions. In public health and community-based interventions, there's this notion of identifying champions. Identifying who are the people who can take an intervention and push through, make it possible, gain trust within the community, etc., etc. This is incredibly important, especially as a foreigner trying to support a local project. The lesson I learned is it's not just about identifying the champions, but it's about empowering the champions. Because not everyone is a natural extrovert or a natural go-getter in that way, but there's so many capable and brilliant people whose hearts are in the right place and they want to do something good. These are untapped human potential. And one of the most important things with a project like mine, where you're taking all these documents and creating a guideline, the most important thing is having someone who can implement that guideline, because otherwise we might as well have just kept the status quo. To empower the champions in this project, we went through the medical director. In Burundi, there's a lot of hierarchy, a lot of respect culture, especially among genders. My mission isn't to change gender dynamics in another country that I'm not part of the culture, but my mission is to improve quality healthcare. So I took all that context in understanding the role of someone like a male boss and understanding the power of that authority in empowering someone else. And he chose two incredible people, one of whom was much more introverted, and she was super brilliant, you could just tell, but she was a little bit unsure and unconfident in herself. And within the context of gender dynamics in a country like Burundi, this is not that unfathomable. Even in the streets, you see that men tend to talk louder and women are quieter. There's certain cultural norms that just exist. We're not here to judge them, we're not here to change them, but for the purpose of our intervention, let's understand their dynamics and what the opportunity is. The opportunity here was there was an incredible woman who had all the capabilities to take on this project and make it amazing, to improve the quality of the clinic, and all she needed was a little bit of encouragement. We emphasized that she was chosen to take on a good amount of responsibility by the medical director. People like her are really going to make a change on the ground. They're going to save lives. They're going to improve the quality of healthcare, and having them as champions is just, it's like the greatest pleasure. Third lesson, do imperfect baselines. In academia, in white-collar work, we are so obsessed with perfect reports and perfect data and all of this methodology. Now, when you're doing a PhD thesis, I can totally see the merits of needing to write down your interview objectives and having an informed consent document and having all of these different things. However, in the real world, these perfect baselines and methodologies and ways of doing things are actually less helpful than doing an imperfect baseline. And when I say imperfect baseline, I mean optimizing for insights. I'll give an example. I spent 2 days doing an infection prevention baseline, basically talking to every single staff, including the accountant. The purpose was to understand how they thought about infection prevention and where they thought the clinic could improve. I started with 5 guiding questions and I had a few interviews. I realized that some of the questions were not as insightful as I thought they could be, and so after a couple rounds, I switched up the questions. I added a few more, I edited them, I tweaked what I emphasized when asking them. But when you're working with a clinic and you are working for that clinic, it is not about how you structured the questionnaire and how you stayed consistent and reduced bias. It is about literally just understanding the infection prevention baselines and making that the North Star. So I did. As a result, my first interviews were different than my last interviews. Does that make the data non-uniform? Yes. Does it make the baseline imperfect from a rigorous academia standpoint? Yes. But it was more insightful. I could have spent a couple more minutes or a couple more hours devising those baseline questions, but when I go onto the field, I still could have found that I wasn't getting the insights I needed. And that's because you don't know what you don't know. So instead, I would say ditch that perfect baseline. Perfect is performative. Imperfect is about action. Imperfect gets things done. Perfect is about those really nice documents. And there's one more lesson I'll share, which is don't optimize for efficiency. In the first few weeks of my projects, I did the most meticulous, mundane work. And I think that was the best thing I could have done. Because when I came in, I had a very broad problem statement. It was, how do you improve the quality of Ubuntu Village of Life, the clinic? That's very broad and ambiguous because what is quality, what is improvement, and what is at Ubuntu Village of Life? That's where I started. I tried to understand the details, the nitty-gritty of what made quality improvement in this clinic. That first week, I digitized the pharmacy, literally went through every single medication, typed it on my computer, typed its function, and counted the number of pills. But I got so intimate with things like, how do they organize the pharmacy? How easy is it to grab things from the pharmacy? What do we have in the pharmacy? Do we have duplicates? Where do our name brands versus generic brands go? It was that insightful data. I wouldn't even think to ask someone, oh, do you ever have trouble grabbing something from the back of the pharmacy? Or what's your process for expired drugs? Because I just noticed there's like 3 of these packages that are expired next month. Like I said earlier, you don't know what you don't know. And doing that meticulous data collection that could be optimized and could be outsourced, it's actually really useful. So what else did I do? I took a picture of every single corner of the clinic, went on my computer, downloaded all of them, and then captioned every single one. I spent a couple of hours just watching the patient flow, understanding where people sit, what do? Do they talk to people? Are they lost looking around waiting? But those little observations ended up completing the full picture of the clinic. And I couldn't have just relied on the conversations that I had with people or what people said about the clinic, because words and actions aren't always equal. So in general, if you are shying away from the dirty work because you want to be efficient, unfortunately, you are probably not going to solve these really messy, complicated systems change problems. I will leave you with just one anecdote, which is that most of the greatest books in human history were written by a typewriter or by hand. So if you think your artificial intelligence, large language model, quantum computing, cloud efficiency, optimization, productivity software is the thing between you and doing great work, you are thinking about great work in the wrong way. To summarize the 4 lessons, we have save people time because it'll probably save you time in the end. Empower the champions because they will be the ones to drive the results. Conduct imperfect baseline assessments. Don't worry about how the data will look in the spreadsheet and if it's clean to analyze. Care about the insights and the wisdom you can gather. And lastly, don't optimize for efficiency. Efficiency comes later when you have a system and you know what works. Also, thanks so much to anyone who is taking the time to watch these entire videos. I really, really appreciate it, and I hope you enjoyed. Thank you so much.